Hi, this article is from Cleveland Clinic, a very good source of medical information. And the title today is Increased Intracranial Pressure, or ICP. Increased intracranial pressure, ICP, is a life-threatening condition that happens when there is an imbalance between your brain tissue, cerebrospinal fluid, and brain blood volume. It has several possible causes. Signs often include headache, vomiting, and vision changes. The sooner you get treatment for ICP, the better. Increased intracranial pressure, skull, blood in arteries and veins, cerebrospinal fluid, CSF, brain. Normal pressure, blood volume increases, CSF volume increases, brain volume increases. Increased intracranial pressure. Increased intracranial pressure, ICP, right, happens when there is a rise in pressures within your cranial vault. What is increased intracranial pressure? Increased intracranial pressure, ICP, happens when there is a rise in the pressure within your cranial vault. It can be sudden, acute, or develop slowly over time, chronic, and has several possible causes. Your cranial vault is a rigid compartment for your brain, cerebrospinal fluid, CSF. This is the fluid that cushions your brain and the spinal cord. Also, there's a spinal cord in the cranial vault, blood. Any increase in the volume of one of these three components will increase the overall pressure within your cranial vault. Increased intracranial pressure typically leads to a decrease in blood flow in your brain or to brain herniation when brain tissue moves. Both of these are serious, life-threatening conditions. Symptoms and causes. What are the symptoms of increased intracranial pressure? Signs and symptoms of increased intracranial pressure in children and adults include headaches. They are typically worse in the morning or when you are lying down. Nausea and vomiting. Altered mental status, which can range from drowsiness to coma. Vision changes like a blurred vision, double vision, and or sensitivity to light, photophobia, eye movement problems, muscle weakness, numbness, seizures. Signs of ICP in infants include drowsiness, bulging of the soft spot, fontanelle on the top of their head, vomiting. Increased intracranial pressure is a medical emergency. Go to the nearest hospital if you or your child have these symptoms. Bulging of the soft spot, fontanelle, right? Late signs of increased intracranial pressure. Cushing's reflex, a collection of three conditions that happen together, is a late sign of increased intracranial pressure. It includes high blood pressure, hypertension, slow heart rate, fewer than 60 beats per minute, bradycardia, irregular breathing, mainly gasping for air, agonal breathing. These signs mean that brain herniation is about to happen. Go to the emergency room immediately if you have these symptoms. Well, my heartbeat is about 56, 58. My pressure is good, but sometimes it's high, like 127. That means I have a ICP. What causes increased intracranial pressure? There are several possible causes of increased intracranial pressure. To understand why it happens, it helps to know how intracranial pressure works. There's a fixed amount of space in your cranial vault, meaning it doesn't change. The amount of brain tissue, brain blood, and CSF you have must remain in balance to have healthy intracranial pressure, which is normally less than 20 millimeters of mercury, right? Millimeters of mercury, Hg. If there is an increase in the volume of one component of your cranial vault, like a brain tissue, it will result in decrease in volume in one or two of the other components, like a CSF and or blood. But the overall intracranial pressure increases. Because all the cranial vault components are crucial, an imbalance leads to significant health issues. Healthcare providers categorize the causes of ICP based on which components is causing elevated pressures. Causes of an increase in brain volume, generalized all over brain swelling, cerebral edema, can happen from traumatic brain injury, blood flow tissues issues in your brain, ischemia, high levels of ammonia in your blood, hypoammonia, decreased brain function due to a buildup of toxins in your blood from decreased kidney function, uremic encephalopathy, low sodium levels in your blood, hyponatremia. I should look for ammonia in my blood system, blood flow, right? Traumatic brain injury, a buildup of toxins in my blood. Swelling can also develop in specific parts of your brain from intracerebral or subdural hematomas, types of brain bleeds, brain tumor, brain abscess, stroke. Causes of increase in cerebrospinal fluidity, right? The amount of CSF in your brain can increase due to hydrocephalus, choroid plexus tumor, a rare type of brain tumor, meningitis, granulomas on your meninges. Causes of increase in brain blood volume. You can develop increased brain blood volume from ruptured brain aneurysms or hypercapnia, increased blood carbon dioxide levels, cerebral venous sinus thrombosis, heart failure. Other causes of increased intracranial pressure, other causes of ICP include benign or idiopathic intracranial hypertension, skull deformities like craniosynostosis, too much vitamin A in your body, tetracycline on antibiotic use. Diagnosis and tests. How is increased intracranial pressure diagnosed? A healthcare provider will assess your symptoms and ask about your medical history. They will also do a physical exam and neurological exam. Tests that can help confirm an ICP diagnosis and or underlying cause include CT scan, MRI of your brain. These imaging tests can show issues like brain swelling, enlarged ventricles, and brain herniation. They may also reveal the underlying cause of ICP. Fundoscopic exam. This is a type of eye exam. It can reveal swelling of your optic discs, pallidoma, which is a sign of ICP. Lumbar puncture, spinal tap. This procedure measures your cerebrospinal fluid pressure and can help diagnose certain causes of ICP. A provider can also measure your CSF pressure by drilling a small hole in your skull and placing a special device or tube, catheter in your cranium. Management and treatment. What is the treatment for increased intracranial pressure? If you have a sudden increased intracranial pressure, you will receive treatment in the intensive care unit (ICU) of a hospital. Your healthcare team will closely monitor your neurological and vital signs. Treatment depends on the severity and underlying cause. It may include elevating your head, draining cerebrospinal fluid to lower pressure in your brain, breathing support like intubation and mechanical ventilation, medications like barbiturates to decrease brain swelling, anti-seizure medications to prevent seizures, which can worsen ICP, removal of part of your skull, decompressive craniotomy to allow your brain to swell without compression. This is a last resort treatment if all other methods haven't helped enough. Your healthcare team will also treat the underlying cause. Care at Cleveland Clinic. Well, I'll just stop here and come back later. Thanks for listening. Have a wonderful Wednesday. I have to work now. My work officially starts at 9 o'clock, but you need to have 20 minutes more ahead to prepare and to think. Thanks for listening. Bye-bye. Back to my dorm in Seoul, and I'm going to finish the rest of the article. Outlook. Prognosis. What is the prognosis for someone with increased intracranial pressure? The prognosis outlook for someone with increased intracranial pressure varies based on the severity, the underlying cause, and how treatable it is, how quickly you receive treatment, if ICP is sudden or chronic. Sudden ICP is often life-threatening. Prompt treatment typically results in a better prognosis. If the increased pressure pushes on crucial brain structures and blood vessels, it can lead to permanent brain damage or even death. While chronic ICP, like from idiopathic intracranial hypertension, is typically less severe. Without treatment, it can lead to blindness. Additional common questions. What is the first sign of increased intracranial pressure? The first sign of increased intracranial pressure is often a headache that's worse in the morning and when you are lying down. This is the most common symptom of ICP. So when you are lying down, when it's in the morning. A note from Cleveland Clinic. Your brain is a vital organ that does so much. When it experiences damage, it can lead to serious problems. That's why it's essential to get medical help for increased intracranial pressure ICP as soon as possible. If you or your child develop a headache, vomiting, and vision issues, don't hesitate to go to the hospital. Quick treatment of ICP often leads to better outcome. Care at Cleveland Clinic. If you have a neurological condition, you want expert advice. At Cleveland Clinic, we'll work to create a treatment plan that's right for you. Yeah, I'll visit your clinic when I get a winning lottery ticket this weekend. Thanks for your article. Your article was very helpful, and I learned many things from this article. ICP, right? Blood, cerebrospinal fluid, brain, right? Aneurysm, and all sorts of things. High blood pressure, toxins in the blood system, all contribute to the increased pressure in your intracranial vault, right? Vault. We gotta be careful, right? Thanks for listening, and have a wonderful Wednesday night. Tomorrow is Thursday, and Friday I only get to work in the morning, so I will leave my office at 2 p.m. on Friday, and I will head back to Gwangju area, but not Gwangju itself, but I will go to Busan to meet with my extended family members, right? My brothers, my sisters and their families, and my mom. We all get together at Mohang. That's quite a beautiful, rustic, small port town just outside Kunsan City, where the American Air Force is located. Before I close this article for the day, I would like to go over what I stored to remember. Well, there's nothing, so I'll just skip it. And I wish you a happy Wednesday or Wednesday night, wherever you are. And good luck. Bye-bye. Ciao, ciao.